Pregnancy, parenting with a disability. What to expect. Paralysis does not prevent a woman from becoming pregnant and having a baby. Morning sickness, headaches, and swollen ankles are among the normal side effects of pregnancy. But for women living with an SCI, there are special considerations. Risks. Pregnancy amplifies secondary health conditions such as urinary tract infections, pressure injuries, and spasticity. To mitigate risks, you'll need a doctor who is familiar with spinal cord injuries and aware of all your underlying health conditions because special complications may arise from existing health issues. Urologist. Begin by visiting a urologist before becoming pregnant. A baseline checkup of the kidneys, bladder, and ureters will help doctors monitor changes that may occur during pregnancy. UTIs. Pregnant women should be especially alert to urinary tract infections as they can cause early labor. Catheters. Catheters must be monitored during pregnancy. A growing baby bears down on the bladder, leaving less room for urine to gather. To minimize the risk of urinary tract infections and to reduce the frequency of catheterization, women sometimes need to switch from an intermittent catheter to an indwelling catheter during the later stages of pregnancy. Physiatrist. The American Academy of Physical Medicine and Rehabilitation provides a searchable database of practicing physiatrist members who specialize in spinal cord injury throughout the country. Obstetrician. A high-risk obstetrician may be best equipped to manage comprehensive care for pregnancy with an SCI. AD. Women with spinal cord injuries at T6 or above are at increased risk of developing autonomic dysreflexia while pregnant. This potentially life-threatening condition causes dangerously high blood pressure. And symptoms, including headaches and nausea, can be mistaken for normal side effects of pregnancy. So it's critical that your doctor understands and monitors these symptoms throughout your pregnancy. AD wallet cards containing baseline blood pressure, level of injury, and emergency contacts are available online, or call the Reeve Foundation's Paralysis Resource Center at 800-539-7309 to have one mailed. Labor and delivery. By the third trimester, the additional weight of a baby can slow blood flow. Compression stockings and elevating feet when possible is recommended, and it's important to be conscious of regularly shifting body position in order to prevent pressure injuries. Find out if you need to use a contraction monitor at home. Women with limited uterine sensation should receive weekly cervical exams beginning at 28 weeks and should be admitted to the hospital once cervical dilation or effacement begins. Vaginal delivery is feasible for many women with spinal cord injuries. Visit the hospital in advance to confirm it's prepared for labor issues unique to patients with spinal cord injuries. And prior to labor, you and your anesthesiologist should plan for early and continuous epidural anesthesia in order to prevent the onset of AD.